Bone metastasis. I'm Dr. Nathan Good, your medical director at Brio-Medical in Scottsdale, Arizona. Conventional medicine looks at cancer that is spread to bone metastasis, or bone cancer, as a threshold of no return. Uncurable, though the term cure is not a medical validated clinical endpoint and shouldn't be used in the discussion with patients. But looking at cancer that is spread to bone, the way medicine looks at it, there's no going back. However, here at Brio-Medical, we're able to do some amazing things guided by the evidence. A couple different therapies here that can be incredibly impactful for bone cancer or bone metastasis. Number one, medical cannabis. Medical cannabis is incredible in terms of targeting bone-related pain. There's probably no pain that's more affecting of quality of life than pain associated with bone metastasis. Medical cannabis, guided by the evidence, is a clear way to target that bone metastasis pain and that's related to it, not suppress the immune system like opiates do, but actually reduce the pain, improve quality of life, and not hurt the body. Novel concept. Number two, high-dose IV vitamin C coupled with a very old antibiotic called doxycycline. Studies have shown that when you combine high-dose IV vitamin C with doxycycline, again, when dosed properly, frequently, and in terms of delivery into the tissue, here the bone, that doxycycline, very old antibiotic, pushes that high-dose vitamin C into the cancer in the bone and does a much better job of eradicating the tumor that's in the bone. So here we're actually integrating two therapies, one that's a conventional, but actually using it repurposed, doxycycline, but coupling it with high-dose IV vitamin C, a quote-unquote alternative therapy. So it really shows you how we can integrate in a wide variety of ways. The third point is hyperthermia. Hyperthermia, and here I'm talking about real whole body hyperthermia, between 39 to 42 degrees Celsius. What this does is it really destroys cancer that's in the bone and really stimulates the immune system. In fact, there's a gentleman by the name of Dr. Kobayashi who has done whole body hyperthermia for 35 years, and he said that, quote, there's no better therapy for the treatment of bone metastasis than whole body hyperthermia. So, medical cannabis for the eradication of the pain related to bone metastasis, but not destroying the immune system. Number two, high-dose IV vitamin C coupled with doxycycline in a truly integrated manner. And the third is actually using hyperthermia via whole body to actually not just target the tumor in the bone, but to actually stimulate the immune system. And finally, it also helps other therapies to work better when coupled with it, such as giving high-dose IV vitamin C during whole body hyperthermia. And this is even beyond the use of what are called like bisphosphonates, like Zometa and Xgeva, which conventional medicine uses and sometimes can be helpful here. So when we truly approach things holistically, integratively, irregardless of medications, we can truly target a healing, integrative strategy to not just reduce pain, but to target tumor in the bone, whether it's primary or secondary via metastasis. That's what it looks like here at Brio-Medical in the treatment of bone cancer or bone metastasis. To learn more about the treatment of other variety of cancer types beyond just primary bone cancer or bone metastasis, I encourage you to go to our website, watch the videos there. Thank you for watching. Thank you for listening.